Wow, great. Now we continue. As I mentioned in the beginning, it's a chance for us to give you updates about what you've been up to, and then to receive feedback from you. We're going to have presentations that's going to focus on an overview of Vibrant, our 3-year strategic plan, and some client service updates from our health center here, and then from our attendant care sites, and also our wellness programs. Now I know, and we are expecting feedback from you. There will be questions time at the end. So I'll plead with you to please note your questions, and then let's have the presentations. At the end, we'll have time to take these questions and respond to them. For our folks online, you can drop your questions in the chat box, or if you want to be heard, my colleague Amir is coordinating. He'll give you the opportunity if you signal to ask your questions, and then you get your response. We'll start off with our presentations. We'll be taking presentations from our executive director, our director of client services, our manager at the attendant care sites, and also our manager for healthcare services here at the health center site, and then our supervisor for community health. Let's give a round of applause to invite our executive director, Cameron, to start us off with the presentation.
Thanks, Dennis, and thank you again to our singers. I wore my pink thinking maybe one day I'll get to join the group. That was wonderful. Thank you all for joining. My name is Cameron Duncan. I am the executive director here at Vibrant. I want to also just put a special warm welcome out to everyone that we have online. I see a few faces. I want to acknowledge that we have Lauren Marks, one of our finance managers here. We have Dr. Karen Fleming, who is our new medical director. We also have Dr. Sasdev, who is Sunnybrook's Chief of Integrated Care Program. Wonderful to have folks. I also see a number of attendant care clients and clients from the health center also joining us, which is great. I'm going to get the slideshow back on, and that will remind me what I want to talk through. One moment. While we go through, so we're going to go to slide 5 at least. Next slide. And next one again. So I want to give a little bit of an overview. Many of you, if not all of us, are familiar with Vibrant Community Health at some level. I want to just give a recap and make sure that everyone understands who we are and what we're about. Vibrant is unique as an organization because of 2 functions that we have. First, we are an attendant care service providing organization, which provides attendant care or assisted living services at 3 locations in Toronto. We also are a community health center, and this is unique. We're able to provide attendant care services, health services, and wellness programs. These encapsulate the work that we do, making us very holistic in the engagement that we're able to have. Next slide. Who do we serve? Vibrant, if you look at who we are serving, first and foremost, it is clients with barriers to care and equity deserving populations. And you'll see this including seniors, you'll see people with physical disabilities, you will see newcomers in the community, all eligible and looking for services and part of the community and the DNA that we call Vibrant. You'll see some photos from our SAGE group. You'll see some participation in Pride that we had a few years ago as just indications of who we are and the groups that we're working with. Next slide. what is our mission statement? What is our reason to be, our raison d'etre? We are here to provide holistic health and community services. Why do we do that? We're doing it to enable independence and well-being. So the holistic work that we're doing, and who are we doing this for? Again, it's for individuals with barriers to care. And that is who we are. That is why we exist and why we show up every day. Where we are, I mentioned that we have 4 locations at Vibrant. You'll see in green, there is the health center. That is here at Yonge and Eglinton, where I'm situated today. And then we have 3 attendant care sites in other parts of the city where we're providing the assisted living services to clients there. So we're spread out. We are not only here for many folks who may be in and out of the health center. We have additional space and work that we're doing. Next slide. How we communicate. I think it's important to understand how we communicate and how we engage with folks. First of all, we have a website, and that website we updated last year. It is the best place to go to get your quick answers, to understand everything that's happening, to understand Vibrant. We have an e-newsletter, an email newsletter that we send out monthly, and this goes out and it shares stories. It may highlight the theme of the month. It will also be a place to understand what are the upcoming events, what are the upcoming nuances that we have here at Vibrant. And so that is one of the best places for you to learn about us. And at the end of this meeting, we do have here a place where you can sign up if you're not receiving these already. Here at the health center, we also have a rack with flyers, which is a great way to understand what is available, what are the programs that are going on. That includes also a calendar, which has all of the monthly activities and everything that you can expect. It's also right there on our website under the Engage. You can see our calendar and see what are the things that are happening. Maybe I'm coming for an appointment next Tuesday. Maybe I'm curious about what other programs may be happening and whether I'd be liking to join those as well. And I'm going to skip online booking, so we'll go to the next slide. How we listen. How we listen is also equally important. It's right in our name. We are community, and community is not a one-way thing. It is not just us reaching out. It is not just us providing services. That communication is so important. We have a robust, vibrant community council made up of individuals, clients who participate in our attendant care, in our wellness programs, and in our healthcare. This group of individuals come together regularly to give their insights, help us answer questions, and provide a real understanding about what we have going on. They're a tremendous pulse check for myself and for the team overall. On top of that ongoing engagement, there also is the annual engagement survey, and we did that again in January. Every January, we roll out that survey. It's a really important time to be hearing from our clients and understanding what's going on, what are the needs, what are the things that we're doing well, where can we improve? And you're going to hear elements of that baked into the presentations that are coming later this afternoon. We also have feedback forms here at the health center. They're right down at the reception, but also online we have the feedback form on the Engage page, a place where anyone can give feedback either anonymously or with your name, so that we're just continuing and having an opportunity for feedback there. Next slide. Connecting online, in our survey, we heard that almost 90% of our clients are online. They have a computer, they have internet at home, they use email. We want to share that one way to reach out is always through our info@vibrantch.ca email address. And again, on our website, vibrantcommunityhealth.ca, which has the elements for booking some of your appointments online, asking questions, filling in the feedback form. It is one of the really practical ways that you can connect with us. Next slide. And so with that, I'm really glad to remind everyone and share a little bit, and we're gonna go back a few slides, about the strategic plan. That's good. We launched last year in this annual meeting, our strategic plan. It's a 3-year plan looking from 2025 to 2028. Again, this was created and crafted because and through all of the engagement that we had with our clients, with other partners in the community, with our similar attendant care and community health center partners. All of that information came together and we established a strategic plan for ourselves. There were 3 key strategic directions that we captured and built into this plan. The first was to deliver top quality services for our clients through our healthcare, our attendant care, and our wellness programs. So again, the top quality and really building, making sure that we have excellence in everything that we are doing. A second important element was the fact that we realized and heard that we need to grow. There are so many individuals in our community who don't yet have the services that they need, the services that Vibrant provides. And so there is very intentional work for us to grow. We want to be able to serve more people, have more programs and services so that we are addressing that need and really reaching out and meeting the community where they are. The third and equally critical element to this is that we need to remember equity, and we need to be very intentional about that. The strategic direction number 3 is ensuring equitable access and inclusive practices. It includes championing the independent living philosophy, a key tenet and structure of the attendant care that we provide, guiding and saying we take direction and we look to our clients to select their own care and their own approach to the work that we're offering. It also is prioritizing clients with barriers to care. And again, barriers to care, it's an abstract idea, but you can think of all the things that make it harder to receive services. It could be that you are in a wheelchair, physical disabilities right there. It could be that you're new to Toronto or new to Canada, and so it's a new language, it's a new structure. How do I actually find that care provider? It could be that there's stigma or discrimination that folks are feeling that make them feel less welcome or less able to find the services that they need. We are here for that, and that work with the barriers to care and these clients, this community, who we are, is so important to us. And so that is just a reminder of our strategic plan. We launched it last year. We are 1 year into this plan, which means we already have a lot to talk about in what we've accomplished and a lot that we have coming up. And so with that, I am very glad to, oh, no, I'm still doing more. All right, we'll keep going. So let's do a quick review of last year and what we've accomplished. Next slide. There were a few operational elements that I think are important to remember and acknowledge. Many of you remember or acknowledge that we changed our name last year. Many of you are part of that conversation. Previous name, Vibrant Healthcare Alliance, we shifted to Vibrant Community Health. We wanted community to be right baked into our name, really emphasizing who we are and what we are about. There was an incredible adjustment with our governance restructure integration, where we joined with Sunnybrook Health Sciences Center last year. This was tremendous work. Many of you were part of the consultations that we had in the months leading up to that integration. We had our membership vote very strongly towards that integration. That took place April 1st of last year. What has that meant? There were a few pieces that we committed to, that Sunnybrook committed to with this integration. First was that our programs and services would continue. We wanted to make sure that we didn't lose the momentum, lose any of the critical work that we are providing. That has continued and we've been strong in that. Beyond just maintaining that, it has been around the growth and the strengthening of us as an organization. And much of that has been invisible. It is all of the work that Sunnybrook has been able to provide in terms of back-end support with our finances, with our IT, with our HR and human resources, elements that come together that really are making us strong in building that foundation. We now share a board of directors with Sunnybrook, and that allows, again, this close engagement and interaction with the organizations. There have also been a lot of renovations, particularly here at the health center. Many of you may remember it was just last year when the elevator was out for months because it was broken, because it was unreliable. We had that fixed and we had that structured. The walls have been painted, there's a lot more art up and around, and these are some of the cosmetic elements. If you arrived here at the health center today, you would have seen all of the scaffolding around as we are repairing our roof. That is almost done. I'm excited for the flowers and plants to have a little bit more sunshine and catch up to the rest of the gardens in the neighborhood. The Vibrant Community Council I mentioned has remained strong and so engaged in many of the operational elements, the strategic elements, and the very practical elements. There will be some highlights and appreciation, but we have events for International Day for People with Disabilities, for Women's Day. We've done a Jane's Walk the past few years. All of these events and special themes are only made possible by our Vibrant Community Council, and so that has just been so invaluable. As we have a new board structure with Sunnybrook, we also found it important to find another way to make sure that the board of directors was hearing from and about Vibrant. And so a Vibrant Community Health Advisory Committee to the board of directors was established. We have several clients on that board representing attendant care, representing healthcare, wellness programs, representing the equity deserving populations that make up Vibrant, alongside myself, Michelle, our Director of Client Services, leadership from Sunnybrook. It includes our new medical director, Karen, who I mentioned earlier. There are a number of us folks who come together regularly now to be reviewing the strategic and governance elements of Vibrant, and that has been a tremendous kickoff and success over the last year. Next slide. And so with that, having gone through the operational, I'm delighted to invite Michelle Heath, our Director of Client Services, to come talk a little bit about what have we achieved with our services over the last year.
Thanks, Cameron. That's an excellent overview. Hello, everyone. As Cameron said, my name is Michelle. I'm the Director of Client Services, and I work closely with both the health and wellness programs at this location and with the attendant care programs and staff at our other 3 locations. And I just want to, as Dennis already pointed out, Lavender, Allison, and Janice are program managers of attendant care and the health center, and Janice is our supervisor of community health. Will be coming up to talk about some specifics related to the programs that they're responsible for. But I just wanted to give you a bit of the highlights and overview of what's been happening over the last year. Next slide, please. So I guess some of the program highlights that we wanted to highlight are, as Cameron has mentioned, we've really over the last year and a half or so been focusing on elements of program expansion and growth. And we were able to get some additional funding last year that was given to us by the Ministry of Health. It was very much focused on services and program provision at the health center sites, which is great for our health center, but we didn't get additional funding for our attendant care programs. We're continuing to fight for that because we need that very much as well. But with the new funding, we were able to fill some new positions, as has already been mentioned. Janice is our new supervisor of the community health programs at this site. Dennis is our MC, is also our new supervisor for allied health services at this site. That's been really, really helpful in our being able to deepen our planning and grow and expand some of our wellness and allied health programs. Janice and Dennis have also been working really hard to find opportunities for programming that integrates community and allied health. There are a few programs that are coming up and that are going to be starting very soon. And I'm hoping Janice can remind us of that because I've forgotten what they are already. Sorry. But yeah, we're really excited about the work that Dennis and Janice have been doing. They've been here, each of them, for about 6 months, and they've already hit the ground running. And we're really, really pleased and proud of all the work that they've done. Again, as Cameron mentioned, you know, health centers, community health centers have always been about providing service for those folks who have barriers or have difficulties accessing healthcare services. And so we're going to remain committed to the priority populations that Vibrant Community Health has focused on and worked with for these last whatever how many years. That includes people with physical disabilities, seniors. We want to get back to having more of a focus on youth. That has kind of drifted away a bit, but with our new supervisors and staff in place, we're hoping to grow and expand that. And we're really excited, as Karen mentioned, to focus on within the communities that we serve, are there individuals who could benefit from the services that we provide, either at this site or at our other sites, that we can be reaching out to, connecting with, and bringing them in to get any range of services that we have available throughout Vibrant Community Health. So we're very excited about getting more deeply into that work in the coming year. Connected to that is outreach and community awareness, which the organization has been focusing a great deal on over this last year, related to ensuring that folks in our community who are not already connected here are aware of Vibrant Community Health and all of the really valuable services that we provide here. So Janice has been taking with her team a huge lead in many of the outreach initiatives that we have been engaged in over the last number of months. And just making sure the community knows who we are, where we are, what we do, and how folks can get involved. And then the last area I want to focus on is last year we were able to secure funding so we could put a manager at the attendant care program in place, which has been invaluable in helping to stabilize that program and allowing us to really focus on areas of improvement, stabilization, and growth that we're looking forward to in the attendant care program. And over the last year, through Lavender's initiatives and through Cameron's, our executive director, there's been much greater connection with partners in the attendant care sector, which has been invaluable in allowing us to work together in learning from each other in terms of how our programs can be best aligned to meet the needs of our clients, but also looking to develop strategies, collectively working together to advocate for more funding for our attendant care programs, which have historically, unfortunately, been underfunded for a lot of years. So we're really hopeful we can have some movement in that area. Next slide, please, sir. Excuse me. Excuse me, I have a head cold, I apologize. So one of the things we just wanted to highlight, because it's been a huge initiative, predominantly again at this site, at the community health, at the health center site. We didn't get $1.8 billion, unfortunately, but we got a small piece of the very large investment that the provincial government made to primary health care. It's an ongoing commitment that the government has made. They want every person in Ontario to be attached to a primary health care provider. And we're part of that initiative. So again, we received some money that allowed us to expand our primary health care services to make connections and work with other doctors' offices in this community, so that they can be supported to bring more, clients onto their own practices. And as I mentioned, we are able to expand, staffing, increase our staffing that can help support that, initiative to find those folks in our community who don't have a primary health provider and get them connected here or other places that are most convenient for them so they can have access to primary health care. So we're really proud to have been part of this initiative. And I'm also very proud to say we've been working really hard, our medical secretary team, our health team, managers and supervisors, and of course our ED have all worked so hard. And we're at 90% of our target, for the target that was set by the ministry. So we're very, very, very excited about that. And this is Jane Philpott, the person responsible for this initiative. Next slide, please. Okay, client services in the year ahead. I think if you would just go to the next slide, please, Amir. This is where I'm going to be turning it over to our program manager of the attendant care services, Lavender Gill.
Thank you, Michelle. You have a photo. So I am Maria Lavender. I'm the attendant care program manager. So right now what we've actually been doing is we've been doing a lot of work in our attendant care program at all 3 sites. So I've actually gone and I've met each and every single one of our clients to get a little bit of feedback, what's working, what's not working. So I want them to be the voice of basically our, moving forward with what we're going to be doing and what we can improve for all of our clients that we are, that we care for. So, what we've been doing as well, we've been working on our service agreements. So we've been renewing all of our service agreements with all of our clients, reviewing our policies for all of our clients and all of our staff. We've also been doing a lot of staff training that we're going to be offering this year. So our staff are going to be being trained in all sorts of, our back here safes and lifts and transfers. So that is something that we'll be working on for any of the training for our staff members. And if there's anything that our clients wish to have where our staff are training, we are going to be trying to implement that. So at least our staff are able to, communicate openly with our clients. We've also been, Cameron is working hard as well diligently with our sister organization and with SIL, so this Center of Independent Living in Toronto. And we'll be working on the independent living philosophy. So that is something that is important to all of us. We are going to be working on that and to ensure that our clients have their voices back and to ensure that we are ensuring that each booking is being directed by our clients. And we will be doing that also when we're going to be doing our training as well. An exciting portion that will be coming also, we will be introducing a new CRM system into our attendant care program. So it's going to be a new record where all of our clients, the scope of service is going to be in our client service agreements. And all of our, anything that are to do with our clients, when we're in our information session. So it'll be all in one area, secure. So at this current time, we do have 43 clients in all, in our attendant care program. We are looking to expand. So we are looking to expand in our outreach program. We are looking to expand it in, throughout the community. So hopefully with Michelle and Cameron's funding, hopefully comes through soon. And then we will also be working on our training for goal care. So the clients are all our staff are all gonna be trained. So we'll be training them on that. And I will be also introducing it to our clients as well. So they're fully aware of what's in our systems. So like we said, we get out, so we do have currently 43 clients in our attendant care site. So our wait list, we also go through our ASAC wait list. So again, the Toronto Independent Living in Toronto. So we are getting new clients on board. We do go through that process. We are looking, again, like you said, we are looking for more partnerships out there and engagement out there so we can expand our programs as well. Oh, introduce the manager for that help. Here's Heather Allison.
Hi, everyone. I recognize many familiar faces, but I'm Allison Alexio. I'm the Manager of Health Services here at the Vibrant Health Center. My office is on the main floor, so you've probably seen me walking around downstairs. And I oversee all of the fun things here at the health center. I oversee primary care, allied health care, and our community health and wellness programming. So very excited to have you all here today. I want to give some updates from my side of operations, primarily in healthcare. You might have seen some new faces, some ads on social media or online. We have been accepting new clients for almost a year now. And with that, we've been able to hire 2 new part-time physicians. So they, along with our other primary care providers, are currently accepting new clients. We are also hoping, we do have another part-time physician starting in a couple of weeks. Her name is Dr. Caitlin Sue. So she'll be joining the team and she'll also be taking on new clients. We are hoping to have a nurse practitioner starting with us full-time as well. That is pending. And then we do also have one of our nurse practitioners who is retiring. If you are one of her clients, she would have already spoken to you, but nurse practitioner Marilyn Brownlee will be retiring at the beginning of July. So yes, if you're one of her clients, you would have known that already, but if not, and you know her, she's here on Mondays and she'd be happy to connect with you and have an opportunity to say goodbye. She's been here for many years and many people have really great relationships with her. As Cameron and Michelle both mentioned, we really have a strong focus for our healthcare team on equity and community. We have historically seen mostly people with physical disabilities and seniors with complex healthcare needs. As we've opened our intake over the last year and a bit, we are seeing new populations come through the door, which is really great. So we are shifting and opening up to welcome these new populations. As you will see, as you're coming through the health center for appointments or wellness programming, there are a lot of newcomers that have registered for primary care with us and are now registering for different types of programming in allied healthcare. There are a lot of young families with young children new to the area. We historically also had a lot of youth here. We are hoping to ramp that back up. One of our nurse practitioners, Brody Marks, she is going to start focusing on some youth outreach to get more youth through the door, alongside with our new registered nurse, Nahima. They're going to work in tandem. And yeah, I lost my train of thought. We are constantly looking to explore new groups and find ways to support different equity deserving groups in our community. We also love to hear feedback if you are part of another equity deserving group and you feel like there's opportunity to create some programming or just social opportunities to connect with other like-minded folks. We are always open to hearing that feedback because we're looking for new ways to expand all the time. Something for everyone that's a healthcare client to be aware of is that very soon we will start to have some academic learners at the health center. The first one will actually be starting this summer, and they will be shadowed by our new physician, Dr. Caitlin Sue. So you will see there, I believe there will be signage posted, and your providers will give an update to this. But you will start to see learners, which are students, coming through the health center, and they might be attending your appointments with you. Dr. Karen Fleming, who's our medical director, she is online right now, and she can actually speak a little bit more to this as these students are coming through her department at Sunnybrook. And she will be supporting our team and overseeing those students. So Karen, yeah, if you wanted to add additional context.
Hi, thank you. And it's lovely to meet everyone here today. So I wear another hat when I'm not wearing the Vibrant hat in the chief of the Department of Family and Community Medicine at Sunnybrook. So the learners that we're talking about here would be people who are fully graduated, they're no longer medical students. They've gotten their medical degree, and they are coming to do a 2-year residency program to build their skills in family medicine across the lifespan. So we're very excited, and we had a lot of people who wanted the opportunity to come and be with the physicians over and nurse practitioners and rest of the team. And 1 day a week, they will be over with Dr. Caitlin Sue, assisting and providing care across the lifespan. So, and we will be putting up documentation from the University of Toronto about what is a family medicine resident. What can you expect from a family medicine resident? And it's kind of nice. You've got 2 for 1. So I'm happy to take any questions at now or in future about what that might mean. But exciting times. We all want to build more capacity in our local community.
Thanks, Karen. Does anyone have any questions for Karen about the learners that will be on site? Or if you don't have them now, you can always reach out to us in the future. Yeah, Susan?
I would make a suggestion that could be an orientation with all of the doctors in training, or however you want to frame it, so that they get to see the full community and not just one group of patients or doctor, because you're referring to one doctor in the whole of the vibrant community. So that's why I'm suggesting maybe as part of the orientation, you introduce a number of clients to those doctors.
Yeah, absolutely. I think that's our goal. So currently we're only starting with one physician that's accepting, or that's not accepting, but we're only starting with this one learner with the one physician, but we are looking to expand. There will be more learners coming on board. And they will cross all of our primary care providers that are interested in supervising learners. And because of the nature of our clinic, our providers cover for each other. So they will see clients that are not theirs when that client's provider is not working that day. So the learners will have a unique opportunity to see a wide array of clients as well.
Well, the reason I'm bringing this to your attention is because I don't want to overspeak for somebody else, but I can say that people with disabilities in general are not treated appropriately in hospital environments. And the more people these doctors are being actually exposed to us and realize that we are people and not just, and we do have the ability to think for ourselves. And we have a lot to say, as you can see. That it really will make a difference in the future of medical care in every single hospital.
I absolutely agree, and I actually think that's why it's a great collaboration and opportunity that we have for these learners, because we have such a high population of people with physical disabilities that get healthcare services here. They will have that opportunity to have a lot of one-on-one experience with this population, and to really understand the barriers to care, how to use that information in their own practice going forward to prevent and they'll try to eliminate those barriers as well. Do you have anything to add, Karen?
No, I was typing it in the middle, but so thank you for sharing, and I echo your concerns with care and wanting our emerging physicians and other learners to have a better understanding of different populations, and learning is the first key part about that. And thank you for your commitment to working with the next generation of learners to help us to do better.
Thank you. Any other questions about the academic learners that will be here? Again, you can hold your questions until they come to you at some point. But they can filter through me. I can filter them to Dr. Karen Fleming as well. And and we can get back to you. We do appreciate any feedback. Okay, I will continue on the healthcare updates. Another focus that we have in healthcare, Lavender and I are going to be working together to ensure that all of the attendant care clients living at our three assisted living sites are, as long as they want to be, attached and involved to services here. So whether that be via primary healthcare provider here or with a wellness program, or allied healthcare services through OT, PT, whatever that may be, we are doing our best to collaborate. As Lavender said, she'll be doing a service needs assessment with all of the attendant care clients and ensuring that collectively we are doing everything that we can to make that to meet everyone's needs. So that is a focus of healthcare and a good collaboration that we're existing, but we're working on that collaboration to ensure there's an additional focus on our attendant care clients. Next slide, please. How to join us. So as I mentioned, for the last year, we've been accepting new clients to primary healthcare services. As a client of primary healthcare, you are eligible for all of our allied healthcare services as well. Many of them, because they're in such high demand, are only open for our primary healthcare clients. So you do have to be registered with a primary care provider to access those services here. Our priority populations, first and foremost, will remain people with physical disabilities. We are a fully accessible healthcare clinic, and we want to make sure that anyone in the GTA with a physical disability, if they're experiencing barriers to healthcare, that they are welcome here. They will be accepted here as a client, and we will do our best to provide the best level of healthcare that we can. Our other priority populations or our other eligibility requirement for primary healthcare are people living in North Toronto, so people living in the immediate area without an existing primary healthcare provider. Our catchment area is Bloor to 401 from the north and south, and Bayview to Bathurst from the east and west. So that is the North Toronto catchment area that we'll be looking at. And we will take anyone of all ages. There's no age limits other than the geographical area. And then anyone that lives at one of our vibrant attendant care sites, they are also automatically eligible for primary healthcare services. The other way. Great, okay. So that's all from healthcare. Oh, sorry, did you have a question?
Like, under that geographical, and this still eligible?
Sorry, some of the sites outside of the geographical area? Oh, yeah.
These aren't limited to the geographical area, can meet anyone in the GTA.
I'm sorry.
Yeah, sorry, so just for clarification, our folks with people with physical disabilities, we do not hold a catchment area for those clients. If they need access to healthcare, even if they have someone where they live that's just not accessible for their healthcare needs, we will also accept them here as a new client from anywhere in the GTA. So as long as you're able to come here, at least for the initial appointment and for in-person appointments when needed by your provider, you are absolutely welcome to come here for your primary healthcare services.
That's how I know.
Exactly, that's how many people got involved. We have relationships with a lot of other hospitals and programs that serve people with physical disabilities. So those are wonderful avenues and relationships that we have. That's it for me, but I would like to welcome Janice Young as our community health supervisor.
Hi, everybody. I'm the last speaker, just in case if you're curious. But I wanted to first invite Janella up here. As you can see on the slide, the very first item is a program overview. But I really wanted to highlight one of our wellness programs and give you guys a little bit of a flavor. So I'd like to call Janella up, and she's part of our knitting group, and she's just going to showcase some of the great work that everyone does in that group.
Hi everyone, I'm Janella. I came here just about a year ago, so I'm pretty new to Vibrant. I did a meeting, I was in contact with the knitting group. That's why I got started. And we been doing a lot of good things there. We, the stuff that we do, we donate it to different, homes. We meet on a Friday in the afternoon, and the group is great, because when I just came, I think they only had 4 people, the instructor and 3 others, but now there's about 20 people, and it's growing. So, because we were downstairs and now we're upstairs. Now we meet up here, so the group is great, but it's very good, and, some of the stuff that we have done is in the hallway. It's been showcased in the hallway. So anyone who's interested, you can sign up at the front desk, or you can come every other Friday. And it's not only meeting, we come together, we talk, we have conversation, you can meet a new friend. Because when I just came, I was very shy. But now
I don't believe that, you know.
and I do other groups as well, and I also do, women on the move, because that's why I have to run downstairs, because I'm working on a project that I have to do something at, Metro Hall.
What day?
Yeah, we're doing that thing at Metro Hall on Monday. So, I was working on my work downstairs, and there's also, just different programs. You just have to know what you want to do, and even if you're not interested in it, just give it a try, because for me, I find I've always wanted to know how to knit, and now it's going very good for me, because I'm 1 year in and I've learned a lot. Like where I started with just the little red scarf, and where I am today, it's like night and day, like you say. So, so it's pretty good. So I just want to say thank you for inviting me, Janice, and thank you all for coming, and just see what's there that you need. Everything might not be for you. Just take what's for you and make new friends and memories and that sort of thing. Thank you. Bye.
Thank you so much, Janelle. And for the record, she's being humble. Like in 1 year, she is a pro. So definitely, like she mentioned, there's a table outside. We're showcasing some of the amazing work that Entazar's group, the knitting group, does. So come take a look. And she's gonna go back to her group now. But thank you again, Janelle.
Janice, can I just add, because Janella referenced it. No, go ahead, Janella. I just wanted to say that the knitting group actually makes lots of beautiful things and donates them to women's shelters and women in need. So it's a win-win, that program, as are many of our programs. But I just wanted to highlight that as well. Thanks.
Thanks, Michelle. Yes, for those who can't hear online, she was talking about how our knitting group and everything that they do knit are donated to women's shelters. So it's also just this reciprocity wraparound kind of community care that we give each other. But with regards to that, just a general overview of our programs. I see a lot of familiar faces. I see a lot of people who are accessing our programs here, so very happy to see you all. Outside as well, in addition to the showcase of the knitting, we also have some of our flyers as you exit out the door. We can also share with the folks online if you're interested, just share a little interest in the chat. But if you'd like to visit those as well, we'll also be showcasing some of our programs. And then speaking of programs, we do have 2 new ones coming up. So you've heard a lot about these new populations that we're seeing here in Vibrant, and you're hearing a lot of, I guess, overlap or sort of repetition, but I think that's a good sign because it's showing that all of us are in alignment. So for example, one of our new priority populations are newcomers. We're seeing a lot coming through the health center. So I'm happy to announce that actually tomorrow, some of our team from the community health team will be going to the Toronto Newcomers Day. And so we'll be promoting our new newcomers support group. So the pilot session is going to be on June 25th. The new shiny flyer is also outside of the table. And then speaking of another new group, we've also identified men. There's not a lot of like men specific programs out there. So we wanted to sort of shine a highlight on that, provide a lot of support. So we've got a new men's support group coming up as well. The pilot for that is going to be Monday, June 29th. And again, the fancy shiny new flyers outside. So if anyone is interested or knows of anyone who might be interested, definitely take a couple and share them for us. In addition to that, I just wanted to speak really briefly about our Vibrant Community Council. I see a few of our members here. First of all, thank you for being on the council. And secondly, I just wanted to mention that, as Cameron said, we've been working a lot. They've been very valuable to us. We're also going to be recruiting for new members in September. So if you've ever thought about volunteering and you want to hear or be more involved with Vibrant, that's also a fantastic opportunity, and we'll be opening up applications. Well, actually, they're open indefinitely, but we'll be focusing more in September for recruiting. So again, if you're interested, you don't need to wait, just approach myself and we can chat. And with that,
A few more slides.
We're shining the spotlight on you today, Janet.
So we have this slide here. I just wanted to show you guys. Cameron did speak briefly about outreach. We've been doing a lot of outreach to the community health team. Some of this, as you can see in the center here, we can see our two community health workers. Starting from the left is Alex and Rain. And then we've got Cindy, she's one of our new caseworkers. And then Kathy, one of our newest volunteers making harm reduction kits with us. So this is at Shoppers Drug Mart, just near the health center on Yonge Street. We're actually continuing with Shoppers. The next one we're going to be doing just in a couple more weeks will be at the Mount Pleasant location. In addition to that, in the month of June, we'll be partnering with the North Toronto, Ontario Health Team, and we'll be doing some outreach at the TTC stations as well. So we're getting our name out for Vibrant. Everyone's gonna know and already knows about us. And then in addition to that too, we've also done some outreach at the Young Eglinton Center. And I think I bumped into a couple of you while we were doing that there. So lots going on at Vibrant, lots of exciting things. Next slide, please.
Yep.
Perfect. So this photo here, and again, I'm seeing some people that joined us. This is from our most recent James Walk. Such a fun event, you guys. I know some of you have participated as well. If you didn't get to make it, we'll be holding another one next year. But basically, this year's James Walk, we had a little bit of a different flavor from the previous years. We had both staff and clients provide some stories and just some ideas and insights at the different stops that we were at, including perspectives from people with disabilities, of course, and then also from a newcomer perspective as well. And so we'll be doing this again next year. So if you missed this year, definitely keep an eye out for next year and join us, because it's always a super fun event. And then as well, so our wellness programs, as you all probably know, and if not, if you'd like to know more, you can see here there's a screenshot on our website. The calendar and a list of all of our available programs is under our website under Engage. In addition to that, Cameron or Allison also mentioned our flyers by the reception area. You'll always find a monthly calendar there, so you can get a whole list of what's going on for that month. And in addition to that, at the table, if you need assistance signing up with more wellness programs, or you just want to know about everything that we offer, that will also be available for you guys after this meeting. Now I'll hand it back to Benny.
I just want to say that if I wasn't already a volunteer, I would want to be. Thanks, Jen.
We have indeed highlighted a lot of highlights. Thank you all thank you, a big thank you to all the presenters. Among others, they've told us about our expansion works, our IPCT funding, improving attendant care services, the policies, and client-directed care. We've got some flavor from the knitting group, who has now moved from downstairs to upstairs. Our newcomers group, our new men's group. A lot has been going on here. Now is the time for questions. If you have them, our folks online, you can start typing out your questions or signaling us. Amir is monitoring that. If you have any question, based on the presentation that's happened or any other thing about Vibrant, we have leadership here, we have staff here to respond to you.
Were the questions online here?
I have a question, and maybe this is something that I just assume everyone knows. We talked about knitting. We talked about knitting specifically as one of the programs. I'd like to hear it again. I don't know how to knit. Am I allowed to come? And two, what is the cost of this program? How expensive is it? What happens there?
Yeah, there's a pushback.
Such great questions, Cameron. So I was taught how to knit, I think, when I was 8 years old, and I'm not gonna share how old I am now, but it was many years ago and I definitely forgot. So I may have, as staff, slipped away from my desk and maybe joined the knitting group for like 10 minutes. And everyone was so helpful and welcoming and friendly. And they taught me how to, if our knitting folks know these terms, but to cast on onto the knitting needle. And I know how to knit now, so no, you do not need any experience at all. And everyone's so helpful, they'll teach you. And the second question, this is the best news, it is free. So we have the knitting needles, we have the yarn, we get donations all the time. It's all completely free. And again, this is a really great social group, as Janella mentioned. It's not just knitting, like you can participate as much as you want. You can sit there silently and knit if you're not feeling particularly social, or if you're feeling lonely and you want to talk to people, that's also an option. So yeah.
Great, thanks. Any other question? Yeah, Susan.
I have a concern with regard to the support. I live in the, and this is just for the people who don't know me. I'm on the committee, advisory committee. I'm very involved in just about everything. I've been with the organization of the attendant care side for 34 years. So anybody who has any questions about history, you can talk to me because supposedly I know it all. I've experienced it all because I've been on the boards of directors prior to doing this. And I'm really concerned that the staff of the support seem to have their own agenda and or they do not use the phrase please or thank you. They're constantly asking us to assist them in assisting us, but they don't use those phrases, which drives me crazy. I don't know about anybody else, but please and thank you was always part of how I grew up. If you didn't say please or thank you, you didn't get anything.
Thanks very much, Susan. I think that is very helpful, good insights. And I think that leads me to a question, sort of following that. We've heard a little bit about independent living philosophy. Yes, you're engaging with those ILAs, the independent living assistants who we're working with. So always encouraging and expecting that back and forth dialogue with any one of our staff who are there. But I have a question for you, Lavender, which is, I have a concern or I have a question. How do I best, or a complaint or feedback, how do I best share that? What is the appropriate avenue for individuals, especially with attendant care?
Thank you, Susan, for that question. So what we're doing is we're gonna be the complaint policy. So the complaints or anything that clients want to follow up with, myself, Kiros and Constantine, who are the site supervisors for each of the sites, you can come to us, we will follow up with the staff member. So we just want to ensure that, you know, your voices are being heard. We do follow up, we do that continuity where we are actually also training our staff as well. So the training is going to be coming for our staff at the attendant care sites. So anything that there is a concern or if there is something that's working, something that's not working, this is something that we are going to be working on, and this is going to be our main focus for the next, few months, for the next year. So again, training is going to be happening for all of our ILAs this coming year. And again, feel free to call us, call me anytime, email me anytime. Constantine and Kiros are also there as well. Our door is always open where you can come in. Our staff, we will be doing up that follow-up with everybody. And we will ensure that, everyone is getting the utmost quality of care that everyone deserves.
Thanks, Lavender. I had a client stop me in the hall a week ago and ask me the exact same question. They said, I have a compliment. I have an ILA who is just doing such fantastic work. What do I do with that information? What do I do? And I said the exact same thing. First off, tell them. I think it's so important, and I know that we have so many incredible staff. Let them know when they're doing a good job and when you're appreciating them. But if you also want to reach out to Lavender, Kiros, Constantine, any of our other supervisors to say, hey, that ILA, that staff member is doing a great job. Rain or Alex, our community health workers, doing a great job. Sharing that with the supervisors is also wonderful. And I think it's just great to have all of that feedback ongoing. So thanks for that. Any more questions or comments before we wrap up? All right, it's gonna be 2 and, oh, yes.
I was talking about medical appointment. It used to be that if we had a medical appointment at a hospital, you could get one of the attendants to come and assist you. But that doesn't seem to be happening anymore, and I wondered why.
That is a great question. And I have 2 follow-ups. First, I'd like to hear from Allison to hear about what sort of PSW services do we have here? And then I'd like to hear from Lavender about any services going to other clients.
So in reference to healthcare appointments that happen here at the health center, we do have a PSW on site Monday to Friday from 9 to 5. Her name is Monica, many of you know her. And if she's not here, that we do have she is amazing. And if she's not here, we do have another ILA that will cover for her. Or we also have our registered nurse that will also cover if we need someone to cover. She has experience working with people with physical disabilities. Her name is Mahima. So we do have during the weeks supports available here at the health center. And I can let Lavender speak to any external support.
So our clients for the attendant care program, if anybody is needing assistance to go to any medical appointments or hospital appointments, as long as you guys let us know in advance, myself, Constantine or Kiros, and we will make the proper arrangements. So we do actually have those where PSWs are able to, our ILAs are able to go to their appointment with you guys and just give us the time, a date in advance, and we will make the proper arrangements.
Thank you.
Yes, Susan?
Actually, I think there's some confusion over that issue. Because, I think there's some confusion over that actual concern. Because some people are being told that service is no longer being provided. And that's why we're asking the question now to clarify, because the messages are not getting straightened out.
I think that was really helpful, and I see the value in today. We heard the answer, it is available, and so reaching out to Kiros, Constantine, or Lavender will be able to provide that. Isn't that a way, and this is part of the ongoing communication work that we need.
How is that possible when the actual person telling you that it's not available is the person you're telling us to speak to?
So Lavender can articulate that and make sure that all staff know that, but you can reach out to Lavender directly then. That sounds like a solution. Great. Yes.
Can you tell me the difference between a PSW and an ILA?
That is a great question.
An ILA.
And the question between a PSW and an ILA.
So sorry, that I actually misspoke. They're not interchangeable. A PSW is a personal support worker and someone that's gone to school as a personal support worker and that has a certificate in that. There is no, unfortunately, governing regulatory body for PSW, so they're not necessarily regulated health professionals, but it is a designation. And then there are ILAs, which are independent living assistants, which support people with physical disabilities in their activities of daily living. So eating, drinking, toileting, changing, light laundry, sometimes meal prep, they support with things like that. And I do believe PSWs, do all of that and also support more in a clinical sense in hospitals and healthcare centers. And ILAs are more day-to-day living activities.
I had a quick question.
Yes.
As a person not in any of your accessibility or sites. Yes, I just had a question, when I go to certain appointments, they, expect me to bring an attendant with me. And, I am a client to merchandise and I'm not necessarily allowed to bring a personal support person with me because they're not able to do that.
Yeah.
And I was just wondering in the event, if I need any support, if, somebody would be able to provide that.
That's a really, really great question. I think that's something that Lavender and I can look into and explore, because historically, it's, oh, never mind. Sorry, we won't be able to do that. I think that's a funding limitation right now. In the future, that might be something that we'll be able to explore. But yeah, right now, we really wanna focus on building up our current staffing team, and funding is a big limitation.
All right.
But I will say, if you continue to experience that, it might be helpful to connect with either Rain or Alex, our community health workers, and they can probably find some resources for people to be able to attend appointments with you.
Okay.
Yeah.
Thank you.
Any other questions? I have a mic.
To build on what Jennifer just said. To build on what Jennifer just said, quite often the hospitals do expect us to take someone away from the environment, the housing environment, and bring them in to our appointments. And I've had to say, no, that's not possible. And they don't understand that. Meanwhile, I'm being told by Constantine that the reason they're not allowed in the hospital environment is because they're not insured if something were to happen. Well, it's also likely because it's also likely because they assume that we're coming from like a nursing home environment. So like I'm, in my experience, I find that a lot of hospitals, as great as they are, sadly are not aware of what independent living sites actually do.
Yeah.
And it's no disrespect to them. If you don't know, you don't know. So, you know, so, yeah.
Yeah, I was going to add that also might be I don't know the word. Thank you, differentiation between the ILA and PSW. I think sometimes, yes, PSWs are regulated to attend clinical appointments, but ILAs are not necessarily. So that might be the difference there.
And in our environment, they don't distinguish.
We do distinguish. ILAs are different than PSWs, and ILAs are helping with activities of daily living versus explicitly clinical support.
For people that are not necessarily involved.
Oh, that's right. I see what you mean. Yes.
Yeah.
That's right. Yeah.
Yeah. Sorry, Susan, didn't speak for you. Thank you.
Yes, I think you actually left when I did, but the difference between, that's okay. The difference between PSW and ILA is that PSWs are personal support workers. They go to school to be specifically a personal support worker, and they get to qualify that. They're not regulated by a college like nurses are, but ILAs do a different program and do not have the PSW certification. PSWs do activities of daily living, but also do clinical support versus ILAs, independent living assistance. just focus on activities of daily living.
It's more,
Drinking, change.
more action.
Laundry, whereas PSWs, again, are more clinical sometimes. Or in hospital often.
Message? Oh, there you go, it's there.
Constantine, you have a comment?
Oh, yeah, can you guys hear us from here at Coxwell?
Yes.
So actually, we have to distinguish something here in terms of visits to hospitals. There's outpatient appointments for which we do send staff to go with our clients to assist transfers and, other, other assistance. However, we don't provide any assistance within if a person is hospitalized, or if there's an emergency and they have to be taken to the emergency, in that case, yes, we do not provide any assistance. This has been the case, for quite a while. But for outpatient assistance with doctor's appointments at the hospital, we do provide, and we have a number of clients who go regularly for that, and also for Lyndhurst to assist with wheelchair seating adjustments, things like that. We have been providing this. So it's important to distinguish between the hospital itself, where a person is taken there as a patient, and an outpatient where we do provide.
Thanks for the clarification.
Thank you, Constantine. Thank you all very much. Our time is up. I want to express our appreciation to the leadership of Sunnybrook who were able to join us today. Our Vibrant Community Council members, Health Advisory Committee members who were able to join us today. To everyone who participated, to our folks online who were also able to join us. The meeting is ending. The discussion is not ending. You can talk to any of us outside. There are flyers. If you want to join any of the groups, you can register. Thank you. Until the same time, around this time next year, we will meet for our all clients meeting for 2027. Have a great rest of the day. Bye-bye.